Hi, welcome to the Fit and Healthy Today show. Today we'll be discussing hair loss, male and female both. When we're talking about hair, on an average, men and women lose about 50 to 100 hairs per day. Over our entire body, we have about 5 million hairs, men, that is, not women as much, and on our heads, between 100 and 150,000 hairs. When we're talking about the causes of hair loss, they're numerous. I have people, customers that come into my stores and they say, I'm losing my hair, what do I do? And boy, there's a series of questions that we kind of have to figure out between us, their physicians, proper testing to determine what the cause of their hair loss could be. Genetics, it plays a big part, particularly in male pattern baldness. When we're talking about by age 40, 2/3 of Caucasian men on an average start losing their hair. So, when we start usually that midlife type of thing with males, and then midlife for females as well, which we call menopause or perimenopause, we often see hair loss as well. Hormones generally, as a rule, for females tend to be a major cause of hair loss, particularly involving progesterone levels. Genetically, women can have issues with hair loss as well, grandma or grandpa, but we see that much more genetically prevalently passed on along the male lines. For men, particularly, and females as well, when we have an over DHT production driven by something called 5-alpha reductase, which is produced in the prostate, in the adrenal glands, and believe it, directly in the actual hair follicle itself, then this actually can convert testosterone into dihydrotestosterone, and hence you'll see your hair loss. This is what we see with male pattern baldness. There are things that speed this up, and we'll talk about that a little bit further, but one of the major causes is we get an excessive sebum buildup in the scalp itself. And remember, I had noted that this 5-alpha reductase is also produced in the scalp. Well, when people tend to eat a higher fat, higher sugar, higher junk food diet, then that causes that the follicles to get clogged. So you get a higher sebum buildup, and then the 5-alpha reductase builds up, and then the hair falls out, basically because it can't get any circulation or any nutrients. So eating excessive amounts of animal fats, keeping the sugars high, having poor circulation to the scalp, and then genetic history, which is the ultimate culprit, but the contributing factors are the diet, the high levels of animal fats, and actually, literally, there are certain types of shampoos or conditioners that you can use on your hair that can cause the blockage of the hair follicles and increase this sebum content. There's a chemical called sodium lauryl sulfate, which is what they clean jet engines with. And if it's not coconut derived, it's kind of like battery acid to the scalp. So it just kind of damages the follicle, causes the fat buildup, and then you lose your hair. So if you have any shampoos with sodium lauryl sulfate, propylene glycol, chemicals that you kind of can't identify, then I would be very aware that that could be a contributing factor to your hair loss. Stress, illness, and autoimmune diseases. People who all of a sudden get sick, their body becomes under extreme physiological or psychological stress, will sometimes lose hair by the handfuls, and that's a form of alopecia meaning hair loss, caused by these items. Pregnancy and menopause, because of progesterone changes or increase in testosterone when you're pregnant with a male baby, can cause hair loss to some extent. Progesterone, particularly in menopausal and perimenopausal women, when the levels drop off, then we end up with this, particularly since environmentally we are very estrogen dominant from all the chemicals and the pesticides, we end up with the low levels of progesterone, and women start combing their hair, and they're seeing not the 50 or 100 hairs down the drain, they're seeing the 200 or the 300 on a daily basis, and the hair starts to thin, and we all kind of panic. So there's things we can do about that, and we'll talk about that later on down the road as well. Drugs. Medications, prescription drugs in particular, majorly can contribute to hair loss. I had one lady come in, her son was on Accutane, 17 years old. His hair was falling out by the handfuls, obviously because high levels of vitamin A and extreme high levels of vitamin A in the Accutane had caused his liver to not be able to properly function. Hormones don't properly get excreted or utilized, and he was losing his hair. Cholesterol drugs, ulcer drugs, Tagamet, blood thinners, certain types of birth control pills, gout drugs, beta blockers can cause, beta blockers meaning for high blood pressure can cause hair loss. Antidepressants, steroidals, particularly those used in a non-prescription form, in other words, illegal steroids. You'll see a lot of the drugged bodybuilders using steroids. They'll lose the hair, and they're 25 and they look like they're 50 because the steroids will increase that dihydrotestosterone production. So they'll lose their hair. Hypothyroidism. Most people generally know about hypothyroidism when they're in their 20s and 30s, but oftentimes hypothyroidism can be triggered by the lack of progesterone, other factors, excessive amounts of dental x-rays in which the thyroid has exposure causes then hypothyroidism, which means an underactive thyroid. Under those circumstances, women will lose their hair, and males as well. Not as frequently, I see it more so with women, but something that a physician can test for, and we'll talk about the testing procedures further on down the show. Crash, fad diets, or gastric bypass. When you all of a sudden lose weight, dropping the fat off more than a pound, pound and a half a week, as oftentimes it happens with gastric bypass, we see extreme hormonal fluctuations. And when you tend to lose fat, you tend to release tons of these estrogens, and they cause your hair to fall out. Progesterone levels drop off. We see this a lot, particularly in females that undergo crash diets or gastric bypass. So slow, progressive weight loss is always the best way if you don't want to have hair loss. Nutritional deficiencies. Sorry, I misspelled nutritional. Nutritional deficiencies including B vitamins, biotin, just overall mineral deficiencies, protein deficiencies will cause you to lose hair or have hair that's thin and not of good quality. So a good nutritional program and a diet that's high in vegetables, whole grains, enzyme-rich foods, nuts. Now the types of foods that tend to contribute, as we noted already, animal fats, hydrogenated fats, those are all types of things that will contribute to the sebum buildup as well. So diet, as far as nutritional deficiencies, as well as actually contributing as far as the blockage on the sebum, disrupting hormones, animal fats and hydrogenated fats disrupt hormones, which can aid and abet hypothyroidism, progesterone deficiencies, those types of things. Poor scalp circulation. Remember I talked about like the sodium lauryl sulfate and some of the heavy conditioners we use on our hair? They can contribute to poor circulation to the scalp. Lack of exercise, lack of movement, not having good blood flow to the scalp can also contribute. So that circulation in the scalp, you know, this obviously has to have blood getting to it in order to grow. So if you have blocked hair follicles, it's not going to get the blood that's necessary to feed the hair itself. Parasites and mites. There are mites that and parasites that can grow under the skin that can damage hair follicles, and a good physician with the proper testing biopsy can determine either topical mites or intestinal parasites. The intestinal parasite tests are about 50%, but it gives us something to go on to see whether or not somebody is suffering from a parasitical infection intestinally wise. Heavy metals. Those people working around heavy metals in computer operations or anything to do with metal as far as, oh my gosh, electricians, plumbers, any industry in which you're working in around heavy metals, and you're seeing hair loss, I think it's a good idea to pluck a few of those hairs and get it sent off for a hair analysis to find out if maybe you might have a heavy metal exposure. That is one of the testing procedures that can be utilized for hair loss as well. Syphilis and sexually transmitted diseases, including gonorrhea. Anything in which your body is continually trying to fight off an infection, and with some of the strains of syphilis nowadays that are antibiotic resistant. Major contributing factor if left untreated, or if it is not treatable, it will cause hair loss as well. If you are losing hair, I usually suggest that people get a hold of their doctors and have a full panel thyroid test done, which includes a T2, T3, T4, and TSH testing. Not just the good old thyroid hormone stimulating test, but a complete panel, which is anywhere from about 25 to 50% accurate. Intestinal permeability tests to see whether or not you have something called leaky gut. Are you absorbing your nutrients available by your physician? Vitamin and mineral analysis. A heavy metal, as we described, and vitamin and mineral analysis can be done with blood, hair, and urine. And then, obviously, when you lack iron, iron is what helps us carry our hemoglobin, our oxygen, I mean. And when you carry oxygen, obviously, you feed circulation to the hair itself, or the hair follicle. I'd like to discuss some of the supplements that are available that can slow hair loss or strengthen hair or increase circulation to the hair follicle itself. Saw palmetto extract, which is utilized a lot for dihydrotestosterone types of exposure. 300 to 400 milligrams of saw palmetto extract can help with that conversion on the 5-alpha reductase. Omega-3 6-9s, those are the good fats in the diet, and you can take them in a supplement form, or if you're doing organic nuts, including walnuts, almonds, and pecans, they help stabilize the hormones. They reduce inflammation, because there are also disorders on hair that can be inflammatory. Psoriasis, a form of arthritis, will form on the scalp sometimes. So they become very inflamed. So increasing these good fats in the diet reduces inflammation. It also helps to carry out some of those bad fats, the sebum. Biotin. I have a really wonderful beautician. We have a great one here. Her name's Odile. And she sends her clients in to pick up biotin to help strengthen the hair. And biotin, which is considered in the B vitamin class itself, can help strengthen the hair and help with hair growth. Iron. We tend to lean more towards food sources of iron or supplements that are food source based if you're iron deficient. Ferrous sulfate is they take old scrap metal, chemically alter it, and they say, here's your iron. And it only has about a 10-15% absorption. So if you're low iron, contributing to hair loss, look for more of a food source iron. There's whole food irons. There's blackstrap molasses irons, iron biglycinates that you can utilize for that. Vitamin C with collagen matrix. Obviously, this is going to have some collagen formation with protein. So vitamin C is very helpful for hair strength and hair growth. MSM also, together with vitamin C, helps with the collagen matrix and can strengthen the actual hair itself. FOT. FOT is used by Oriental medicine doctors, oftentimes in combination with other Oriental medicine herbs, to help slow hair loss, and recommended dosage is anywhere from about 500 milligrams 3 times a day of FOT. Relatively safe with taken with other medications, but if you're concerned, you can always go online and see if there's any contraindications with your medications. Silica or BioSil. These can strengthen hair. Actually, we use it also in joints and with bone health or bone breakages, because it makes for a stronger bond in the cells. And so silica or BioSil can actually strengthen the actual hair itself.